Okay, well, we are here today with our honored guest, Dr. Kynard from Pennsylvania, and we welcome you to the Stroke Wellness session here, this podcast and video. And we're going to learn more today about diabetes. So we talked about that last week when we had Dr. Feely on. And there's just so much more to know about diabetes, and it's such an important topic. So I've got someone here who is also a doctor of physical therapy, and she specializes in diabetes. So I think we're going to learn a lot of really wonderful things. So welcome, Dr. Kynard.
Thank you, Karen, for having us. As you mentioned, my focus with my practice, which is Made for Motion, we focus on diabetes, specifically type 2, because my father had it, and unfortunately he died of complications from it. And I had it as gestational diabetes, and then I ended up having pre-diabetes. And so, and my father actually died 3 months after my second son was born. So at that point I was pre-diabetic, and that was my driving force to get better and to really make a change. I didn't want any gimmicks, like diet gimmicks that are out there. And I knew that it can be done with proper diet and exercise. And I think that was my driving force to, get in shape and, really bunker down and do it. So with proper diet and proper exercise, I was able to to bring my levels down to normal. And even this year I got checked again. I get checked every year to make sure I'm on track. And even this year my doctor had said that, I was even lower than last year. So, it goes to show that with, good habits, lifestyle habits and changes, you can maintain it. And I'm going to tell you, I'll be the first one to tell you, I'm not a perfect dieter. Like, I'm not a perfect clean eater. I don't eat salads all day, every day. I have my occasional sweets and this and that, and I'm still able to maintain my blood sugars because because of my lifestyle changes. And I have retrained my body to utilize that blood sugar in my body. I've retrained my body to utilize the insulin to get that blood sugar out of the system and into the muscles where they belong. And so because of that, I can still enjoy the things that I like and not have to worry about, oh, my blood sugar is going to spike and this and that. So, and I want everyone else to know that it is possible. I was just reading a post yesterday. Someone had mentioned that they just became diabetic, and then a family member said, your family has diabetes, you are diabetic, and you're just going to, and basically telling them they have to live with that. And that's so not true. And I think people feel like because it runs in their family that they just have to deal with that. And that's not the case. My dad had it. I believe my grandfather on my mom's side had it. And someone else in the family had it. But, again, it runs in my family, but that doesn't mean I have to let it run in my family, now that I have children.
Yes. Why do you think that diabetes is so prevalent in the United States, for instance? Why are we seeing this?
I think a lot of it has to do with the obesity epidemic that's going on. And unfortunately, honestly, I was reading the other day and doing some research, and it's not just the US, it's spreading. It's spreading all over the world. In Europe, a lot of people are having increased incidences of diabetes in their communities. And Europe is pretty healthy as far as, the way they live. And but even in Europe, they're having an increased rate of diabetes, and it's going up quickly. And I think a lot of it is because of our lifestyle here in America. We are so used to fast food. We're used to everything has to be quick. And so, our obesity rate is also increasing. If you look at it, it's really hand in hand, the obesity rate with the diabetes rate.
So when do you think, let's say somebody has no symptoms of diabetes, and we may talk about some of those symptoms in just a minute here for those who are maybe don't know if they have diabetes, but let's say there's no symptoms, and why would the doctor start screening, or what age would they start screening normally?
Typically, they start screening at age 40 for some reason. However, I encourage people to look at the risk assessment. On our website, we have a risk assessment test that people could take, and they could determine what their risk of getting it is, because there are a lot of risk factors in determining if you are at risk for getting type 2 diabetes. So, but even like childhood diabetes is becoming more prevalent. And so, and that's scary because, you know, our children should not have to deal with those type of things. I mean, diabetes wreaks such havoc on our bodies. And, you know, if we can control the obesity epidemic, we can definitely stop it from occurring in our children. But again, they don't start looking at it until 40. And, honestly, I call diabetes the silent killer because people don't even realize that they have it until they start having symptoms.
What
My
would
dad,
symptoms be? What would some of those symptoms be?
yeah, the symptoms, for example, increased urination, if you have to go to the bathroom a lot. Some people feel like they have a sweet taste in their mouth all the time. Then there's also, again, you know, being obese, having high blood pressure. Those things contribute to causing diabetes. And then there's blurred vision. There's also neuropathy is a big one. But again, if you have neuropathy, your diabetes is pretty advanced at that point because now your nerves are getting affected. And
Can you explain neuropathy in case someone doesn't understand what that means?
yes, neuropathy is when the nerves are affected by the high blood sugar levels, and basically they get damaged, and so you start to have pain. Most typically, it's in the feet and the legs, and some people even experience it in their hands. So in the further away parts of your body. So hands and feet are the most common areas where people have diabetic pain, and so sometimes it's more like a tingling, sometimes it's more like a burning. A lot of people have sensitivity with their like sheets at nighttime. They can't put their sheets over their feet because it's so sensitive. So it can be very painful, and especially if they're trying to walk. So it becomes painful for people to even walk.
Sure. Do you think that we do a good job of educating our young people about the dangers of diabetes and the causes? So, I mean, I know there's childhood onset, but we're talking today a little bit more about type 2, which is adult
Mhm.
onset. But what do you think is happening in the elementary and junior high schools for education these days?
Well, these days, I don't think they specifically educate people on diabetes itself, especially in children. I personally educate my children about diabetes and let them know that, you know, mommy had it, and this is you know, what can happen if we don't watch what you eat and your sugars. Um, but I think it definitely is something that we need um, to address in the schools. I think also that people are afraid of scaring kids into it, but if we encourage kids to be more active and you know, and exercise more, then, you know, it's something that could definitely be controlled in more of a silent kind of way without scaring people about the effects of diabetes. But parents should definitely be educated about it so that they know, so that they can encourage their children to be more active and eat well.
Absolutely. And if the children are educated, sometimes they may have an impact on their parents, right?
Oh, so definitely, yeah. My kid reminds me all the time, you know, like, mommy, we shouldn't be eating so much sugar. So yeah, kids are very, very good at reminding you what you should and shouldn't do.
So there are also not only risks for diabetes, but once someone has type 2 or type
Mhm,
1 diabetes, but we're talking type 2 today,
mhm.
um, why would that be associated with a high risk of stroke?
Yes, well, my dad actually died of a stroke, a brainstem stroke to be exact. And so because of that, they couldn't help him. But again, diabetes affects our circulatory system. So basically it affects your blood vessels. It thins them out. And so therefore, if you have high blood pressure and thin walls in your blood vessels, you have more of a risk of them rupturing and therefore having a stroke or having an aneurysm or any type of bleeding incident. So in my dad's case, he had high blood pressure, and again with the diabetes, it thinned out his blood vessels, and therefore he had a rupture in his brainstem, and so therefore he literally died because of a hemorrhage stroke.
Wow, I'm so sorry. Yeah.
Mm-hmm.
But
He wouldn't have had it any other way either. He said, if I ever have a stroke, I'd rather go than be stuck, you know. So, you know, in a way, he wasn't suffering anymore because, again, diabetes was causing a lot of pain. It was causing a lot of issues, you know, with having to urinate all the time. And he felt like he was confined to home because he couldn't go out and because he was always urinating. So, so it was very, I think it was a relief for him too, so.
How long did he have diabetes?
When we found out, I would say about a year, because again, when he found out, he was in the 600 levels, and he didn't even realize it. He didn't know until like he started having pain somewhere, and he went to the doctor, and they checked his sugars, and then that's when they found out. But all the while, he didn't even realize he was diabetic, and so, you know, here he was. They were like, we can't even get a reading because it's off the charts, and so it was really, but he was still walking and talking. Normally people think sugar's that high, you'd be in a coma, right? But he was walking and moving around like normal. So, but again, you know, the symptoms were there. His vision was getting worse. He, you know, was urinating a lot. He was starting to have some pain in the legs, and you know, so those were all the symptoms there that we really didn't catch early on. But you know, had we caught them a little earlier, maybe we could have helped him a little better. But for him, the main thing was to not having access to insulin, which I think is a huge problem here in the U.S., where a lot of people tend to not have access to medicine, to the right medicine, and then they end up rationing, which my dad did, and so they don't get the proper treatment. And it's a shame that in our country, where we're so, you know, well off, that we have this problem where people can't get the proper medication.
Long-term effects of diabetic medication. Are there long-term effects for taking insulin or other medications?
Um, I'm not 100% aware of the long-term effects, but the short-term effects, I've heard of many people having like gastric issues with the medications, the oral medications. Not so much with the insulin. Again, it's not human insulin, so it's harder on your body. But insulin is necessary. We need our insulin. But again, it's because it's not human insulin. It's harder for your body to kind of process and digest. So I think in that aspect, it kind of becomes less effective, I think, as it goes along, the more people use it. And so they need more and more and more increased doses. So, yeah.
All right. There are different ways of taking insulin. What would those ways be?
The main way is through injection. Some people have the little vials and they have to inject themselves. Typically, it would be an injection in a more muscular area or a fatty area. And then other ways, they also have pens now that are pre-measured. So you just set it to the measurement and then inject yourself, which is nice. Those are the two main ways for insulin as far as that goes for administering them.
Right. So someone has a stroke and they've already been diabetic. How are they going to manage their blood sugars when they can't maybe exercise like they did before, or their chewing or swallowing is also affected?
That's a good question. Yeah, the the best way, I find that the best way to get to become less insulin resistant is to utilize strength training, because that's where we use the most blood glucose, is when we're doing strength training. That's when the muscles are requiring more energy at that time, versus when we're doing cardio, where we can tap into our fat reserves. So I encourage people to do more strength training. You know, if one side is affected of a stroke, focus more on the good side. You know, there's a good I have a resistance band chair where you can sit down and do all kinds of resistance exercises for upper body and lower body. So if you can't stand, it's a great way to strengthen that way. So you can use resistance bands, you can use free weights. So anything that is comfortable for you to use and safe, then I would encourage that.
That's great. Yeah. What about support groups? Are those helpful for people to find in their area? I mean, get involved in a support group?
I think it's very important to get into support group because it's accountability. It really gives you that ability to, reach out whenever you're struggling with either the diet portion or the exercise portion. Unfortunately, I think a lot of the diabetic groups, like in my area, for example, they focus a lot on just educating you and kind of giving you a whole bunch of information, but then that's it. Then you're on your own. And so part of my mission is to provide more of a accountability portion to it where, okay, you're ready to start exercising and you're ready to start eating better, then I'm willing to be your accountability person to, show you the exercises that you can do and then keep you accountable to keep doing them until you accomplish your goal of decreasing your A1C or, losing weight, whatever it is that you feel you need to do in order to control your blood sugars.
That's wonderful. That's a big plus, isn't it? That's wonderful.
Mm-hmm. Mm-hmm.
So if someone has just been diagnosed with diabetes, what is something that you could share with them that would really impact their lives and keep them well and things for them to really be mindful of? What would you encourage them in besides some of you said maybe?
Yeah, the main thing I think is lifestyle changes because, we develop diabetes through habits, lifestyle habits. And, a lot of times we grow up in a culture, our family culture, our family dynamics, and we pass that along to each other as we get older. And so sometimes you have to break those habits and that culture, and you have to kind of start anew. And I think lifestyle changes, whether it be drinking more water, we don't drink enough water in this country, staying hydrated. Drinking water helps to eliminate any excess blood sugar. So, are you okay? Okay.
Today, I don't know why, but anyway.
Oh. So yeah, drinking water helps to eliminate a lot of the excess blood sugar, and then also getting enough sleep, and then again eating a healthy diet. I've had a registered dietitian on our podcast where we talk about a plant-based healthy fat diet. So it's not keto, it's not anything that's really drastic. People want to cut out their carbs, and I think that's such a dangerous thing to do because our bodies rely on carbs, and we need it for energy. And so if we get rid of it, what are we going to do? Like, what's your body going to rely on? And I read a study that showed that even people on keto after 2 years became insulin resistant again. Why? Because now they filled their body with fatty acids, and that blocks your insulin from transferring the glucose into your muscles. So,
Right.
So even though keto might be something to help you lose weight quickly at first, it's not something that's sustainable. So knowing that a proper balanced diet is the best way to go. And knowing, what exercises to do. You want to do cardio to help you burn fat. You want to do strength training to help you build lean muscle, to help utilize the insulin and the glucose in your bloodstream. So those are all things, again, lifestyle changes. If you can get yourself to do those things, then, it becomes easier. And in the book that I wrote,
I have a book here. Yeah.
There you go. There are tips there for just simple lifestyle changes that you can start with, and get into that habit of healthier options, and then that way it becomes easier to incorporate exercise and diet. So
Wow, that's wonderful. So much information that's helpful and useful for us as we look at stroke care, but also just for the general population. So you may have someone in your family that's not stroke affected, but there are things that can be done to encourage one another in the right direction. Sorry, I've got this niggle in my throat today. Anyway, Dr. Kynard has done this wonderful book, Breaking Free from Diabetes, that I would encourage you to look into. It's available at Amazon. And how else could people get a hold of you? What's your website and your podcast?
The website is www.madeformotionllc.com. And on the website, I actually have a link for the podcast. I believe the podcast is with Anchor. So, and there are other platforms that we're on now. So I believe Spotify and a couple others. But yeah, you can easily grab onto the podcast through the website. And I also have the video blogs there where we talk about all aspects of diabetes and different symptoms. We have our Did You Know Mondays, so we have a question for you. And then on Tuesdays, we try to answer that question.
Wonderful. Wow. That's great. What a great resource. We want to thank you today for your time and being with us today and talking about diabetes and particularly how it can be managed. There is hope, that there are changes that can be made that are very positive.
Yes,
we want to thank you. And we will end here today. Oh, did you have something else?
Yes, well, thank you. Thank you for having me. And I just want your audience to know that just like diabetes is preventable, I believe strokes can be preventable too with the proper diet and exercise. Keeping yourself healthy from the inside out is important. So
yes, we need to be health conscious, which includes our diet, our sleep, our exercise, our social interactions. Mental health is a big deal. All these things, you're a whole person, not just one aspect. So thank you very much. And maybe we'll get you back on again sometime. Thank you so much.
Okay, thank you.
Uh-huh.